Hi everyone, my name is Kai Xin from Group 3. Today, me and my group members, Rabiah Aqilah, Dikshita and Chui will be presented on the unraveling mystery of a heart disease from a case study. Firstly is the information of the patient. She's a 64-year-old woman with no smoking nor drinking alcohol, but she has symptoms started a few days ago which she realized difficulty in putting on her shoes with shortness of breath or minimal exertion. Second is a clinical history and physical finding. For clinical history, she had a history of ischemic heart disease which has been treated, but she also had multiple episodes of transient heart attack before. She also had a family history positive for carcinoma of lungs, happens in the mother, and carcinoma of colon happens in her father. For her physical finding, she appeared lethargic and pale, distended jugular veins, full and equal radial and femoral impulse bilaterally, heart apical impulse displacement laterally. She also had diffuse cracking rales at the lung bases. Her abdomen was also distended down to percussion. Her liver was palpable about 5 cm below the right costal margin. Her lower extremities show pitting edema of both legs. For her other physical finding, she had a blood pressure of 165 per 90 mmHg, which is considered high blood pressure. Her respiration rate was 22 per minute, which also considered high, and her temperature was measured for 37.7 degrees Celsius, which is considered as fever. There are three differential diagnoses. First is a heart failure or heart disease. Due to her clinical history, she had a history of ischemic heart disease, which has been treated, but with multiple episodes of transient heart attacks. In her physical finding, she was tested with high blood pressure, heart apical impulse displacement laterally, which equals to enlargement of heart. Her lower extremities show pitting edema of both legs, and eventually, heart disease causes edema. The second differential diagnosis was lung cancer and colon cancer. Due to she had a family history positive for carcinoma of lungs happens in the mother, and carcinoma of the colon happens in the father, which it could possibly inherited through genetics. In her physical finding, she had diffuse crackling rales at the lung bases, which is related to lung cancer, and her abdomen was also distended down to percussion, which is related to colon cancer. The third differential diagnosis was hyperventilation of pneumonia. As in her clinical history, she had increasing shortness of breath and weakness. She also noticed difficulty in putting on her shoes, along with shortness of breath or minimal exertion. For her physical finding, she was tested fever and had high respiration rate.
I'm Dikshita and I will continue with a presentation. The chest X-ray results show an increase in pulmonary vessel and fluid has leaked into the bronchial wall, thickening it. From the biochemistry result, it can be observed that calcium is high, which may be because the patient is suffering from cancer. BNP is high, which is because she has heart failure. Creatinine and BUN is high and albumin is low, which is due to kidney failure. From the complete blood count, it can be seen that all the analytes such as red blood cell, hemoglobin, among others, are low, which may be because she is suffering from anemia. The blood film is paler in color compared to a normal blood film, which may be because she is suffering from anemia. The red blood cells are irregular in shape and some show oval cytosis. Macrocyte and leukocyte can also be observed. Furthermore, it can also be observed that the patient has a lower O2 saturation and a lower partial pressure of oxygen. Its tumor marker, CEA, is also high compared to a normal person as she is suffering from cancer. Other abnormal results are occult blood in the rectal examination, sinus tachycardia, and an ulcerated mass in his ascending colon. From the histopathology finding, in image 1, differentiated adenocarcinoma can be observed in the colonic mucosa and submucosa. In image 2, there is an increase in nucleus, and in image 3 shows many mitotic figures.
Just now we have mentioned about all the abnormalities that show in the result. Now let's jump into possible diagnosis part. Based on our research, we can know that all the disease that patients have is more likely to complications. To further expand on that, we break this part into two sections. First of all, this patient may have colon cancer that lead to a body increase in calcium. Hypercalcemia can also cause these kidney stone forms and eventually to kidney failure. In the colonoscopy finding, it shows that the polyps presents. Patient also tested positive for a stool occurred blood test, and histopathologist finding image shows invasive from mucosa or submucosa, which is a sign of early stage of colon cancer. Numerous mutative figures present which shows that there is a presence of cancer cells. To further indications of cancer, readings of tumor marker CA test was higher than normal range and indicates increase in risk of cancer. She also has a family history of carcinoma of colon, therefore the risk of developing the cancer was high. Second possible diagnosis is started with lung cancer that can cause congestive heart disease or tachycardia. Due to heart disease, body doesn't have enough healthy red blood cells to carry oxygen to blood tissue, which refers to anemia. When body doesn't have red blood cells enough, hyperpressure occurs in order to increase heart rate, and this also causes to kidney failure. In theory, anemia always associated with chronic kidney failure because when kidneys are damaged, they do not make enough erythropoietin which leads to anemia at the end. We can know that patient heart is not pumping in a proper way, which could eventually lead to congestive heart failure by high BNP level. Arterial blood cancers test results indicates the chance of developing lung cancer. One thing to take note at last is past research shows that high in creatinine level but normal urinalysis can also show in the patients who has hypertension or chronic kidney failure.
I will continue with colon carcinoma. It is caused due to a mutation in the WNT signaling that increase the signaling activity. There are two types of precursor, which is the conventional adenoma and serrated adenoma. In colon carcinoma, the intestine regenerates approximately 6 days, and crypt cells migrate from base to surface, thereby undergoing differentiation and maturation. The laboratory result which help to diagnose colon carcinoma is colonoscopy, fecal blood test, the blood test, histopathology finding, and the tumor marker test.
Thank you, Dikshita. Let's talk more about anemia in this patient. In general, imbalance in erythrocyte loss of deficient erythropoiesis will lead to anemia condition. The Columbia blood count and peripheral blood film finding shows that this patient is suffering hypoproliferative microcytic anemia. It caused by iron deficiency anemia, short form mean IDA. In fact, thalassemia and lead poisoning can also cause this form of anemia. However, from the data of this patient, it can assume as iron deficiency anemia because her family history doesn't have thalassemia and no symptoms shows that she has lead poisoning. Common etiologies of IDA could be internal bleeding such as polyps in colon. The ulcerative polyps present in this patient, ascending colon due to the early stage of colon cancer, are most likely the cause of anemia conditions. I will end my part here and pass it to my groupmate Aqilah, and she will talk about cardiac failure.
Hi, my name is Rabiah Aqilah, and I will now continue with the rest of the presentation, starting from the cardiac failure. Cardiac failure usually starts from a damage or weakening to the heart muscle, which usually caused by the clogged arteries due to coronary artery disease or the increase of afterload from chronic long-term hypertension. The weakening of the heart results in the decrease of the stroke volume. The stroke volume is the amount of the blood pumped by the heart in a beat, whereby the decrease of stroke volume causes the decrease of the cardiac output. Cardiac output is the amount of blood which is pumped by the heart in a minute. Due to this condition, the heart will now try to increase the cardiac output with 3 different ways of compensation. One of way of the compensation is by increasing the heart rate. Increase in the heart rate will able to increase the cardiac output, but it will come along with the second tense, which is the heart will have less filling time compared to a normal heart condition. Another way of compensation is the structural changes in the attempt to increase the stroke volume. Example of the structural changes which is commonly seen is the dilated cardiomyopathy. In this condition, the wall of the ventricles become very thin and the heart is enlarged in order to pump more blood. However, as the negative effects, the heart become more weaker and losing its leverage to pump blood normally. Aside from that, other structural changes that may be seen in the heart muscle is the thickening of the ventricles, which is called as hypertrophic cardiomyopathy. In this condition, the heart wall is becoming thicker but getting stiffer as well, and the heart does not feel in the way of a healthy heart should be. Hence, instead of increasing the stroke volume, the structure changes at times are usually enhance the decreasing of the stroke volume instead. In cardiac failure, the kidney will become unhappy. Due to the lack of blood flow, kidney tend to restrain lots of fluid in order to get enough blood supply, which eventually can progressive into kidney disease or kidney failure if not treated. Basically, this unhappy kidney will release renin, which causes the formation of angiotensin hormone. The angiotensin hormone is then stimulates another hormone known as the aldosterone hormone. The stimulates aldosterone hormone causes the retention of the sodium and water. If this condition is prolonged, the cardiac will tend to end up with volume overload. If the left side of the heart is failing first, blood will start to accumulate to enter the heart. This accumulation of blood occurs in the lung, which then will cause the pulmonary edema condition. When the right side of the heart starts to fail, usually after the failure of the left side of the heart, this condition will cause the development of peripheral edema. In this case, the jugular vein distension or JVD are usually can be seen. Thus, this is pretty much the overview for the pathophysiology of the cardiac failure. Next, there is multiple condition which increase the risk of cardiac failure. Some of the example is heart ischemia, anemic condition, tachycardia or bradycardia or atrial fibrillation, coronary artery disease, hypertension, aortic and mitral valve disease, alcoholic or drug user, and a lot more. To conclude the whole thing from this case study, our group have come to a conclusion that this patient is suffering with two major diseases, which is the colon cancer and the congestive heart failure. Due to the colon cancer and the congestive heart failure condition, this patient is also suffering from multiple minor complications, which include the early stage of kidney failure, hyperventilation and pneumonia, which associate with lung disease, and also iron deficiency anemia. All the minor complications that the patient experiences is the result or the side effects from the two diseases that the patient are currently diagnosed with. Now, as for the treatment, mainly for a colon cancer patient, they are required to undergo a polypectomy to remove permanently their polyps which reside inside of their colons. This patient will also be given up to 10 years long appointment schedule for a series of colonoscopic sections. This prevention step is taken to monitor the relapse of the colon cancer in the patient. Other than that, to treat the iron deficiency anemia condition, patient will be given ferric carboxymaltose intravenous iron instead of the normal oral iron tablet. This is because the normal oral iron tablet is not effective for a patient who is diagnosed with a cancer. As for the heart failure condition, a combination of drugs will be prescribed by the doctors in order to treat the heart problem along with its prognosis. Last but not least, this patient will be recommended to undergo further testing in order to obtain more accurate diagnosis. Hence, that is all from us members from Group 3. We hope that you enjoy with our video. We also hope that you could learn something from our video. Thank you for listening to our video. Have a great day ahead and goodbye.